The World Health Organization reports that more than 41,000 health workers in Africa region have been infected with COVID-19, accounting for 3.8% of all reported cases. Frontline health workers are at greater risk of infection because of the care that they provide to patients. The WHO is celebrating today World Patient Safety Day and saying that healthcare workers need to be taken care of to protect the patients. We have joining us from Abuja studio, Mr. Jelili Kilani. He's the Assistant Director, Clinical Pharmacy and Pharmacovigilance Services at National Hospital, Abuja. Thank you for joining us on the program.
Thank you for having me. Good afternoon.
All right. First, I'd like to get your reaction to the number of community recoveries last night the NCDC recorded coming from the FCT. It is good news, isn't it?
Yeah, it's good news because we're happy that at least we can turn about 2,000 more formerly COVID positive patients. They got well, and then they were discharged. So it's a very good one. It shows that the protocols we've been using have been effective. And so it's a very cheering news. And that, but just like we've been saying, it's not yet Uhuru, and people should still be very, very careful so that we do not encourage the spread of this deadly disease.
We've been told to indeed fight community transmission, being that 73% of the cases are passed through that. What role do you think community pharmacists are playing during this pandemic?
The community pharmacists have been playing a very, very good role in curbing the spread of the disease. First of all, one of the roles is making sure that medications are available and at affordable prices. They also engaged in public education of the people regarding the encouraging people to be very, very hygienic, the issue of hand washing, then hand sanitization, in fact, production and making available the very good quality hand sanitizers. And then I find that many of the community pharmacies also ensure that, in fact, enlightenment of the populace is very much going on. Most of them have stickers and handbills that they give to patients and even people that come there. And they also engage even in public enlightenment. So they have been helping the government in curbing the spread of the disease. And some of them also even donate PPEs to government agencies to help in the fight against this deadly disease.
This year, WHO is saying that the health workers' safety is a priority for patient safety. On health worker safety in Nigeria, how would you say we have fared?
Well, we know that the safety of the health worker is very, very much paramount, because if the health worker is safe, then the patient will be safe. So the World Health Organization actually has chosen a very good slogan. The Nigerian health system has tried its best in making sure that the health workers are safe. There was a time that when this COVID-19 became so rampant and that everybody was panicking, and then the issue of availability and even affordability of PPEs, so, but they were a challenge. But now most of these challenges have been overcome. So PPEs are made available to the health workers, especially those working in the isolation centers. And not only that, even those working in the normal clinics and then pharmacies. So we now have enough PPEs, and that the health workers are also being trained and retrained on the issue of how to make sure that they engage in proper hand washing, hand sanitization, and making sure that they don their garments effectively, and also they know how to doff. Because if, and in fact, part of our training is also that we should not be so much in a hurry to take care of a patient without protecting ourselves first. So that one has been ingrained in us, that, in fact, there's nothing like emergency when you have not taken care of your own safety. Because if you are not safe, then your patient will not be safe, and then even the community will not be safe. So we can say that, by and large, the government has tried to make sure that the health workers are safe by providing safe PPEs and other gadgets that will make us to function effectively and efficiently.
We appreciate your time on the program, Mr. Jelili Kilani, Assistant Director, Clinical Pharmacy, Pharmacovigilance Services, National Hospital, Abuja. Thank you for joining us. And as a health worker, we salute you today.
Thank you very much.